A good day everyone. We will discuss vaginal and preputial discharges in dogs. Vaginal and preputial discharges can be normal or abnormal. They can originate from the external genitalia, the enteroreproductive system, or the distal urethra. To determine the cause of a discharge, a thorough history, including the age of onset of the discharge, the breeding record, and in the female, relationship of the discharge to estrus or pregnancy are especially important. Physical examination and cytology of the discharge are also required. The discharges will be classified whether they are primarily mucoid, blood, or pus. For vaginal discharges, first we have mucoid. In bitches and queens, a mild mucoid discharge is usually normal and the cytology may contain epithelial cells, neutrophils, and some bacteria. During met-estrus, a heavy mucoid discharge is also observed and the mucus may contain large numbers of non-degenerative neutrophils, and it is becoming abnormal when there is an associated irritative lesion in the vagina such as a tumor. A second type of vaginal discharge is hemorrhagic. It is normal during proestrus in the bitch and for up to 6 weeks postpartum. The normal postpartum discharge is non-odorous and greenish to greenish-red for the first 2 to 3 weeks. During pregnancy, abortion may occur if a hemorrhagic discharge develops. If a hemorrhagic discharge persists longer than 6 weeks postpartum, the most likely cause is subinvolution of placental sites. The affected bitch is usually young, less than 3 years of age, and it is otherwise normal. The supportive treatment includes iron supplementation, ovarian hysterectomy, cleaning of peribulbar area, and blood transfusion if necessary. Another cause for a hemorrhagic discharge is neoplasia of the uterus, vagina, or distal urethra. The most common tumor is transmissible venereal tumor. It is usually diagnosed by cytology due to its characteristic large round cells which easily exfoliate. Treatment is based on tumor type. The diagnosis of neoplasia is based on identifying a mass by vaginal examination or uterine palpation and determining the type of cytology, impression smear, or biopsy. The last type of vaginal discharges is purulent. In an intact female, it is important to determine whether the origin of the discharge is the vagina or the uterus. This differentiation is based on the history, physical examination, vaginal examination, and complete blood count. Ultrasound of the abdomen and abdominal radiography may also be helpful. When the discharge is from the vagina, vaginitis may occur, and the principal signs are vulvar leaking and occasional attraction of males. Vaginitis is common in puppies and usually resolves with the first estrus due to estrogen stimulation of keratinization of mucosal cells. And if the discharge is from the uterus, acute metritis should be observed. It is the inflammation of the uterus and caused by Escherichia coli, and some predisposing factors include placental retention, improper manipulation of instrument, vaginitis, or prolonged labor. Another condition is pyometra. It usually occurs several weeks post-estrus or after estrogen or progesterone therapy. It is very common in intact but not bred bitches. Infection with E. coli is common but is secondary to the underlying changes in the uterine wall. Pyometra is referred to as open or closed in relation to the cervix. An open pyometra is accompanied by a profuse purulent vaginal discharge, and no vaginal discharge is evident with a closed cervix. It is the final stage of the cystic endometrial hyperplasia or endometritis complex. In acute metritis, treatment requires antibiotics and supportive fluid therapy. Initial choice of antibiotics are ampicillin, amoxicillin, or chloramphenicol. While in pyometra, the standard treatment is fluid therapy, ovarian hysterectomy, and antibiotics. Also, abdominal radiograph and ultrasound may be necessary to distinguish pyometra from pregnancy or another illness. Now let's discuss preputial discharges. First is hemorrhagic discharge, and the major causes are penile trauma, neoplasia within the sheath, distal urethral injury, neoplasia or urolith, and prostatic disease. The diagnostic plan should include a complete history and physical examination, including rectal palpation of the prostate in dogs and complete examination of the sheath. In dogs, this involves complete protrusion of the penis and may require tranquilization. The most common bleeding preputial lesions in dogs are trauma and neoplasia. The most common neoplasm of the prepuce and penis are transmissible venereal tumor, papillomas, and carcinomas. Treatment depends on tumor type. If the bleeding is from the urethral orifice, urethral diseases such as urethral prolapse, neoplasm, urolith, trauma, or other cause of inflammation are possible causes. The most common cause of a hemorrhagic urethral discharge without other clinical problems is cystic hyperplasia of prostate. It is predominantly characterized by blood in urine and prostatic fluid. The prostate is enlarged but non-painful, and the enlargement is often mild to moderate and symmetric. Giving finasteride at 1 mg per kilogram per day per os for 16 to 21 weeks to laboratory beagles resulted in a 50% to 70% reduction in prostatic hypertrophy with no negative effect on semen quality. With prostatic neoplasia, the prostate is usually enlarged and irregular or contains firm nodules. Prostatic fluid often contains red and white blood cells but is usually not infected. The dog may be in pain, depressed, and anorectic. Because these signs may overlap, a tissue biopsy is often necessary for a definitive diagnosis. Treatment depends on the disease process. A relatively simple treatment offered some efficacy for dogs with prostatic carcinoma are cyclooxygenase inhibitors piroxicam or carprofen that significantly prolong the median survival time of dogs with prostatic carcinoma compared with dogs receiving no treatment. A purulent discharge from the prepuce should be determined to be preputial or urethral in origin by a careful physical examination. The entire sheath should be examined. If the discharge is preputial, the most common cause is balanopostitis. Balanopostitis is characterized by a thick creamy discharge with lymphoid follicular hyperplasia in the sheath. This condition is so common in dogs that a mild discharge is considered normal. And if the discharge is urethral, an inflammatory prostatic disease such as acute or chronic prostatitis, abscess formation, or neoplasia should be considered. The diagnostic plan should include thoroughprostatic palpation, CBC, urine analysis, urine culture, cytology, and culture of prostatic fluid, and abdominal radiography or ultrasonography. Therapy would depend on cause. Treatment includes correcting any predisposing factors, clipping long hair away from the preputial orifice, and thoroughly flushing the preputial cavity with a mild antiseptic or sterile saline solution. Lastly, we have serous fluid. It may drift from the urethral orifice when prostatic cysts communicate with the urethra. The diagnostic plan should include a urine analysis of the discharge and analysis of urine from the bladder to determine if the two are identical. The treatment of choice is total excision of the prostatic cyst. If complete excision of the cyst is not possible, the remaining portion of the cyst may be filled with a leaf of omentum secured with sutures. This omentalization of the cyst will provide internal drainage and lead to resolution.